He looked at the woman wiping blood off the floor and saw a nobody, a tired, aging nurse to use as a punching bag. He didn't see the shrapnel scars under her scrubs, and he certainly didn't know she could dismantle his entire career with a single phone call. The fluorescent lights in the trauma bay at St. Jude's Memorial buzzed with a sick, yellow hum. It was the kind of light that made everyone look like a corpse before they even hit the table. Nora Campbell stood quietly in the corner, double-checking the crash cart. She was 44, her dark hair pulled back into a severely tight regulation bun that defied the stray wisps trying to escape. Her scrubs were a size too large, hiding the lean, corded muscle underneath. She checked the seal on the defibrillator pads. She checked the locking mechanism on the drug drawers. She did it twice. Muscle memory. To the rest of the staff, she was the new hire. A mid-career transfer from some unnamed public clinic, picking up night shifts to pay the bills. They didn't ask questions. In a level 1 trauma center, high turnover was the only constant. People burned out. They broke. They drank too much or cared too little, and then they vanished. "Incoming!" Maggie grunted, blowing past Nora with an armful of IV bags. Maggie was the charge nurse, a cynical 20-year veteran with a bad back and zero patience. "Motorcycle versus semi-truck. ETA 2 minutes. Where the hell is Crane?" "Paging him now," a junior resident squeaked, practically tripping over his own clogs. Nora didn't run. She walked to Trauma Bay 1. She snapped a pair of nitrile gloves over her hands. The rubber snapped sharply against her wrists. She laid out the airway kit. She prepped the massive transfusion protocol tubing. She didn't think about the impending gore. She thought purely in mechanics. Airway, breathing, circulation. The double doors smashed open. The paramedics rolled in a stretcher that looked like a butcher's block. A 20-something male, no helmet. The left side of his face was a swollen purple ruin, and his right leg was bent at an angle that defied human anatomy. The smell hit the room instantly, copper, sweat, and the unmistakable metallic tang of ruptured bowels. "BP is 60 over palp! He's tanking!" the lead medic shouted, scrambling to keep pressure on a shredded femoral artery. Nora stepped in smoothly. She didn't shout. She didn't hesitate. Her hands replaced the medic's on the patient's groin, applying a crushing, localized pressure that immediately slowed the arterial spurts to a dark weep. It took immense physical strength, but her face remained utterly blank. "Get a line in his left AC," Nora murmured to the panicked resident. "Now, doctor." The doors swung open again. Dr. Richard Crane strolled in. Crane was 34, wore custom-tailored scrubs, and carried himself like a minor deity who had been inconvenienced by the prayers of mortals. He was the chief of trauma surgery, a legacy hire whose father had a wing named after him on the 4th floor. He had brilliant hands and a blackened, shriveled soul. "What is this mess?" Crane sighed, grabbing a gown. He didn't look at the patient's face. He looked at the monitors. "Who put this tourniquet on? It's too loose. And why is the music off? I told you I want the playlist running before I walk in." "He's crashing, Dr. Crane," Maggie said tightly. Crane stepped up to the table. He looked down at Nora's hands, which were buried in the bloody mess of the patient's thigh, clamping the artery against the bone. "Move!" Crane ordered. "If I release pressure, he bleeds out in 30 seconds, Nora said. Her voice was calm, measured. Crane's jaw tightened. "Are you the surgeon? Are your initials on the door?" "I said move, nurse." Nora held his gaze for a fraction of a second. She had seen men with 10 times his authority make worse calls, but she was not here to command. She was here to observe, to integrate, to perform her required civilian clinical rotation. She released the pressure and stepped back. Instantly, bright red blood arced into the air, splashing across Crane's pristine gown and hitting the surgical lamp. "Damn it!" Crane barked, frantically grabbing for a clamp. "Suction! I can't see a thing. Why did you let go?" "You ordered me to step back, doctor," Nora said, her tone devoid of sarcasm, which somehow made it worse. Crane aggressively snatched a Kelly clamp from the tray, missing the artery. The monitor began to scream a high, rapid alarm. Give me a debakey! Now! Nora reached for the tray. The sterile setup, prepped by a previous shift, was missing the specific debakey forceps. She grabbed a standard vascular clamp, functionally identical for this immediate, crude stabilization, and slapped it firmly into his palm. Crane looked at the instrument. He looked at the geyser of blood. He slammed the clamp down on the tray, breaking the sterile field. "Are you stupid?" Crane roared, his voice echoing off the tile. The entire room froze. Even the dying patient seemed to pause. "I asked for a debakey. Do you not know what that is? Did you get your nursing license from a Cracker Jack box, or are you just too old to read the labels?" The junior resident winced. Maggie looked down. Nora stood perfectly still. In her mind, she wasn't in a sterile hospital in Chicago. She was back in a dusty triage tent in Kandahar, mortars shaking the ground, dust falling from the canvas roof into open chest cavities. She had kept a 19-year-old Marine alive for 4 hours with nothing but combat gauze, duct tape, and a Leatherman tool. She looked at Crane, she looked at the clamp. "The instrument is sufficient to occlude the vessel, doctor," Nora said quietly. "He is dying." Crane's face flushed an ugly, mottled red. He grabbed the clamp, plunged it blindly into the wound, and clamped down hard. The bleeding stopped. The monitor leveled out. Crane didn't exhale. He turned his full, venomous attention back to Nora. "Get out!" "Doctor," Maggie started. "I said get out!" Crane screamed, pointing a bloody finger at the double doors. "I don't want you in my bay. I don't want you on my floor. You are incompetent. You are insubordinate, and you are a liability. Get out of my sight before I have your badge pulled right now." Nora didn't flinch. She didn't cry. She didn't apologize. She stripped off her bloody gloves, dropped them into the biohazard bin with a soft rustle, and walked out of the room. Her spine was perfectly straight. The break room smelled like burnt popcorn and industrial bleach. Nora sat in a cracked vinyl chair, staring at a lukewarm cup of vending machine coffee. It was black. It tasted like battery acid. She drank it anyway. The hospital was a machine, and Nora understood machines. But this one was broken. The hierarchy here wasn't based on competence or survival. It was based on ego. In the army, arrogance got people killed. Here, arrogance got you a promotion and a reserved parking spot. The door swung open. Maggie walked in, looking exhausted. She collapsed into the chair across from Nora and rubbed her temples. "He saved the leg," Maggie said. "Barely." "Good," Nora said. "Look, Campbell," Maggie sighed, leaning forward. "You need to understand something about Dr. Crane. He's a savant in the OR, but he's a monster everywhere else. He targets the new nurses. He breaks them down. He wants to see if you'll cry. If you cry, he owns you." "I don't cry, Maggie." Maggie offered a tight, sympathetic smile. "I can see that. But you talk back. You don't do that. You just say, 'Yes, doctor,' and you eat the dirt he feeds you. That's the job. We aren't here to be respected. We're here to clean up the mess." Nora took another sip of the terrible coffee. She rolled up her sleeve slightly, revealing a jagged, starburst scar on her left forearm. Shrapnel from an RPG blast outside Fallujah. She rubbed it absent-mindedly. "I've eaten plenty of dirt," Nora said quietly, "but I don't swallow poison." Maggie chuckled bitterly. "Well, watch your back. He's going to make it his mission to get you fired." Maggie was right. Over the next 2 weeks, Richard Crane made Nora's life a localized hell. He reassigned her from the trauma bays to the most degrading, menial tasks on the floor. Bedpan duty, restocking supply closets that were already full, cleaning bodily fluids off the waiting room floor. He made sure to do it publicly. If she was charting at the central desk, he would walk by, drop a stack of illegible patient files on her keyboard, and say, "Try not to mess up the alphabet, Campbell. I know reading is tough for you." If she was assisting another doctor with a simple suture, he would interrupt, critique her knot-tying technique loudly enough for the patient to hear, and roll his eyes. "You handle tissue like a butcher. Step away." The other nurses stopped making eye contact with her. It was basic survival. If the predator was focused on the weak one in the herd, the rest of the herd stayed quiet. On a Tuesday afternoon, Crane cornered her in the sterile supply room. There were no cameras here. The hum of the ventilation system masked the sound of the hospital outside. Nora was counting surgical meshes. Crane leaned against the doorframe, blocking the exit. "I talked to HR this morning," Crane said, his voice dropping its usual theatrical volume for something softer, meaner. "I told them you're a bad cultural fit, that you lack the basic cognitive speed for a level 1 trauma center." Nora didn't stop counting. 52, 53. Crane took a step closer. He hated her calmness. He hated that he couldn't make her voice shake. "You think you're tough? I've broken nurses twice as smart as you. This isn't some pathetic little suburban clinic. People die here." Nora paused. She placed the clipboard on the metal shelf. She turned to face him. She was an inch shorter than him, but somehow she seemed to take up all the oxygen in the room. "People die everywhere, Doctor," Nora said. Her voice was flat, carrying the weight of 100 flag-draped coffins. "The difference is why. They die because incompetent people like you touch them," Crane spat. "I'm the only reason half the meat that rolls through those doors leaves with a pulse. I am the line between life and death." A ghost of a smile touched Nora's lips. It was a cold, terrifying expression. "You're not a god, Richard," she said softly. "You're just a mechanic with a scalpel. And mechanics panic when they encounter an engine they haven't seen in a textbook." Crane's eyes widened slightly at the use of his first name. No one called him Richard. Before he could unleash the torrent of abuse bubbling in his throat, the PA system above them crackled to life, the chime sharp and urgent. "Code yellow. Trauma bays. 1, 2, and 3. All available surgical staff to the ER. Multiple incoming." Crane sneered at her. "We're not done. Grab a mop. You'll probably need it." He spun on his heel and jogged out. Nora took a slow, deep breath. She closed her eyes. The sterile smell of the hospital faded, replaced for a microsecond by the scent of burning diesel and cordite. She opened her eyes. The quiet nurse vanished. The colonel clocked in. The emergency room was a war zone, a multi-vehicle pile-up on Interstate 90 involving a passenger bus and a logging truck. The doors of the ambulance bay were stuck open, locked in a permanent state of receiving. Paramedics yelled over the screams of the conscious and the ominous silence of the unconscious. Blood smeared the polished linoleum, tracked by a dozen running boots. The noise was a physical pressure, crushing against the eardrums. Nora moved through the chaos with terrifying efficiency. She didn't run, she glided, she prioritized. She bypassed the screaming patients. Screaming meant an open airway and strong lungs. She looked for the quiet ones, the pale ones. She stabilized a collapsed lung on a teenager in Bay 3, taping a one-way flutter valve over a chest wound before the resident even realized what was happening. She set a compound fracture on a bus driver in the hallway. Then she heard it, the sound of a room losing control. It was coming from Bay 1. Nora pushed through the crowd of frantic residents. Dr. Crane was standing over a massive, burly man wearing a shredded high-vis vest. A logging chain had snapped under tension, whipping across the man's lower abdomen and pelvis. It was a catastrophic crush injury. The tissue was macerated. "Pressure is dropping! 40/20! The anesthesiologist yelled, his hands flying across the dials. "He's emptying his tank, Crane! Find the bleeder!" Crane was elbow deep in the abdominal cavity. His face was slick with sweat. His eyes were wide, darting frantically around the red lake filling the patient's torso. Suction couldn't keep up. The blood was welling up dark and fast, venous, massive. An iliac vein tear. "I can't see it!" Crane shouted, his voice cracking. The theatrical arrogance was gone, replaced by naked, primal panic. "More suction! Give me more light! Damn it! Clamp the aorta!" "He's bleeding from the pelvis. Clamping the aorta won't stop retrograde flow," a senior resident yelled back. Crane froze. It was only for a second, but in trauma, a second is a lifetime. His hands stopped moving in the cavity. He stared at the blood welling over his wrists. He was out of his depth. The anatomy was completely destroyed, unrecognizable from the pristine diagrams he knew. This wasn't surgery. This was butchery. The monitor alarm shifted from a rapid beep to a sustained, terrifying whine. V-Tash. Nora stepped up to the opposite side of the table. "Step aside, doctor," she commanded. It wasn't a request. The tone carried the absolute, unquestionable authority of a battlefield commander. Crane blinked, pulling his head up. "Campbell, get out of here. I'm trying to—" "You are watching him die," Nora snapped. "Step aside." Before Crane could react, Nora leaned over the table. She bypassed the sterile instruments. She didn't need a clamp. She needed to stop the river. She thrust both hands directly into the pooling blood of the patient's crushed pelvis. "What are you doing?" Crane screamed, lunging forward. "Security! Get her out of here! She's killing him!" Nora ignored him. She closed her eyes. She couldn't see through the blood, so she had to feel. She pushed past the slick coils of bowel, sliding her fingers down the rough, shattered fragments of the pelvic bone. She felt for the heat. She felt for the flow. There, her strong, calloused fingers found the ragged tear in the iliac vein. She clamped down hard with her thumb and forefinger, using her other hand to pack the cavity behind it with 6 rolls of combat gauze she had pulled from her pockets. She pressed her entire body weight into her hands, trapping the vein against the remaining bone structure. "Push 2 units of O-negative, wide open," Nora barked, her eyes snapping open, locking onto the anesthesiologist. "Epi, 1 milligram. Do it now." The anesthesiologist, a seasoned doctor himself, didn't question her. He moved instantly. Crane was hyperventilating, shaking with rage. "You are done! You hear me? You are going to prison for this. You're practicing medicine without a license." "The bleeding is controlled," Nora stated flatly. "Monitor. Pressure is coming up," the anesthesiologist breathed, wiping his own brow. 60/40. Heart rate is stabilizing. He's back in sinus rhythm. The room exhaled a collective, shuddering breath. Maggie, standing by the door, stared at Nora with wide eyes. "You're fired!" Crane hissed, spit flying from his lips. He ripped off his bloody gown and threw it on the floor. "I want security in here right now. I want her physically removed from this hospital." "That won't be necessary, Dr. Crane." The voice came from the doorway. It was deep, calm, and carried a weight that made even the chaotic ER suddenly quiet down. Crane spun around. Standing in the doorway was Dr. Aris Thorne, the chief medical officer of the hospital. But he wasn't alone. Beside him stood a man in a crisp, olive-green Class A Army uniform. 3 silver stars gleamed on his shoulders. Lieutenant General Croft. Behind him stood 2 military police officers standing at parade rest. "Dr. Thorne!" Crane yelled, pointing a bloody finger at Nora. "This nurse just assaulted a patient! She bypassed protocol, shoved her hands into an open cavity, and endangered a life! I want her arrested!" Dr. Thorne looked pale. He glanced nervously at the general, then back to Crane. "Richard, shut up." Crane blinked, stunned. "Excuse me?" General Croft stepped fully into the room. He ignored Crane entirely. He walked up to the side of the table, looking down at Nora, whose hands were still buried in the patient's pelvis, holding the life-saving pressure. The general smiled warmly. "It's good to see you, Colonel Campbell," General Croft said, his voice echoing in the dead silence of the trauma bay. "Though I see you're still refusing to take a desk job." Maggie dropped a tray of instruments. It hit the floor with a deafening clatter. Crane looked like he had been struck by lightning. The blood drained from his face, leaving him a sickly, pallid grey. "Colonel," he whispered. Nora didn't look up from the patient. "General Croft, to what do I owe the pleasure? I'm currently holding a man's iliac vein together, so I can't salute." "At ease, Nora," the general chuckled. He turned to Crane, his eyes hardening into flint. "Dr. Crane, is it? Allow me to introduce Colonel Nora Campbell, United States Army Medical Command, 2-time recipient of the Silver Star, former Chief of Trauma at Bagram Airfield. She literally wrote the Department of Defense protocol on severe crush injuries and massive hemorrhage. She's here on a civilian integration fellowship that my office personally funded." Crane backed up a step, his mouth opening and closing like a landed fish. She's She was hired as a floor nurse. She requested to observe from the ground up, Dr. Thorne interjected, glaring at Crane. To assess the true culture and efficiency of our trauma department before we secured a $50 million military training contract. A contract that Colonel Campbell has the sole authority to approve. Nora finally looked up. Her eyes met Crane's. The arrogant, untouchable surgeon looked small. Shrunken. "Dr. Crane," Nora said smoothly, her voice ringing with command. "My hands are going to cramp in about 10 minutes. I suggest you scrub back in, find a vascular surgeon who actually knows what they're doing, and fix this tear. Because if this patient dies due to your delay, I won't just pull the contract. I'll take your license." Crane swallowed hard, his god complex shattered into a million jagged pieces on the blood-stained linoleum. Yes, ma'am, right away." Nora held the vein, her back straight, her face an unreadable mask of perfect calm. The battlefield hadn't changed. Only the uniforms had. The next 40 minutes in Trauma Bay 1 unfolded with a brutal, clinical precision that left no room for ego. Dr. William Keller, the on-call vascular surgeon, arrived in under 4 minutes. He was a quiet, grey-haired man who lacked Richard Crane's tailored scrubs and theatrical presence, but he possessed hands that moved like a watchmaker's. Keller took one look at the macerated tissue, the pooling blood, and the woman in the oversized scrubs burying her hands into the patient's pelvis. He didn't ask questions. He looked at the monitors, saw the stabilized pressure, and stepped to the opposite side of the table. "I need a clear field, Colonel," Keller said, his voice a low, steady rumble. He had served in the Navy. He knew exactly what he was looking at. "You have a 2-centimeter window, Doctor," Nora replied. Her voice strained slightly. The physical toll of compressing a major vein against shattered bone with raw hand strength was immense. Her forearms burned. Her fingers were going numb. "Tear is jagged. Posterior aspect of the external iliac." "Understood. Proline, 5-0, Keller ordered, holding his hand out. Crane stood paralyzed at the foot of the bed. He was scrubbing his bloody hands uselessly against his gown, his eyes darting between the general by the door and the surgery happening without him. He was the chief of trauma. This was his bay. Yet, he had been reduced to a spectator in his own kingdom. "Dr. Crane," Keller snapped, not looking up from the cavity. "If you are going to stand there, make yourself useful. Grab a diva retractor and pull back that fascia. Gently. If you tear the peritoneum, we lose the field." Crane flinched. Holding retractors was a task for second-year residents. It was grunt work. It was manual labor. But with General Croft watching from the doorway, backed by military police, Crane swallowed his pride. He stepped forward, his hands shaking slightly, and gripped the heavy metal retractor. "Hold it still," Nora commanded. She didn't look at him. She didn't need to. "If you shift your weight, you'll slip on the blood." Crane held it still. He sweated under the surgical lights. He watched as Keller's needle flashed in the tight, bloody cavity, guided perfectly by the space Nora's unyielding grip provided. "Releasing pressure in 3, 2, 1, Nora said. She slowly eased her grip. The room held its collective breath. A slow, sluggish seep of dark blood appeared at the suture line, but it held. The geyser was gone. The catastrophic leak was patched. "Good hold, Colonel," Keller murmured, tying off the stitch. "We'll need to graft it properly upstairs, but he'll survive the elevator ride. Let's pack him and move." Nora finally withdrew her hands. They were cramped into a rigid claw, covered to the elbows in drying, tacky crimson. She stepped back from the table, flexing her fingers slowly to return the circulation. She didn't stay to watch them wheel the patient out. She turned and walked toward the scrub sinks. The hallway was dead silent. The nurses, residents, and techs parted for her like the Red Sea. They had heard. In a hospital, gossip travels faster than a code blue alarm. The new nurse wasn't a nurse. The punching bag was a titanium wall. Nora pushed the swinging door to the scrub room open with her hip. She leaned over the deep stainless steel sink and kicked the foot pedal. The water blasted out, steaming hot. She grabbed a coarse sponge and a handful of iodine soap. scrubbing her skin with a mechanical, relentless rhythm. The door creaked open behind her. Crane stepped into the room. He looked hollowed out. The arrogant sneer that usually rested on his features had melted into something desperate and frightened. He hovered near the doorway, as if afraid she might strike him. "Colonel Campbell," he started, his voice cracking. He cleared his throat and tried again, aiming for his usual authoritative pitch, but failing miserably. "Nora, I want to explain." Nora didn't stop scrubbing. She worked the sponge under her fingernails. The water running down the drain turned a pale, watery pink. "There is nothing to explain, Doctor," she said. "Listen to me," Crane pleaded, taking a step forward. "This is a high-stress environment. You know that. You've been in war zones. People yell. People get tense. I have a standard to uphold here. I save lives. If I'm tough on the staff, it's because weakness gets people killed. You must understand that." Nora turned off the water. She grabbed a sterile towel and dried her hands slowly, methodically. She turned to face him. She looked at him, not with anger, but with an absolute clinical disgust. It was the look a scientist gives a particularly foul specimen under a microscope. "You think you're tough?" Nora asked softly. The quietness of her voice echoed off the tile walls, making it sound deafening. Crane swallowed hard. "I'm the best surgeon in this state." "You have fast hands," Nora corrected him, "and a brilliant textbook memory. But you are a coward, Richard." Crane bristled, a flash of his old arrogance piercing through the fear. "Excuse me." "A coward," Nora repeated, taking a step closer. She didn't raise her voice. "You don't yell at your staff because you demand excellence. You yell at them because you are terrified of losing control, and breaking them down makes you feel secure. You isolate yourself from your team. You refuse to listen to the people standing next to you. And today, when the anatomy didn't match your textbook, when the blood blinded you, you froze. You panicked." She tossed the towel into the hamper. It landed with a soft thud. "In a war zone, a leader who acts like you gets their platoon slaughtered," Nora continued, her eyes locking onto his. "You don't build a team, you build hostages. When things go wrong, and in trauma, they always go wrong, hostages don't help you. They stand back and watch you fail because they are too terrified to speak up. That anesthesiologist knew you were losing the patient. The senior resident knew clamping the aorta was the wrong call, but they didn't push you, because you've trained them to fear you more than they fear a patient's death." Crane opened his mouth, but no words came out. The truth of it hit him like a physical blow. "You aren't a god," Nora said, stepping past him toward the door. "You're a liability, and I don't fund liabilities." She walked out, leaving Crane standing alone in the sterile room, staring at his own reflection in the brushed steel of the sink. The executive boardroom on the 10th floor of St. Jude's Memorial was a different world. It smelled of lemon polish and expensive leather, insulated from the chaos of the emergency room by layers of concrete and thick, soundproof glass. Dr. Hayes, the chief executive officer, sat at the head of the massive mahogany table. He was a politician in a tailored suit, sweating profusely despite the heavy air conditioning. Flanking him were 3 hospital board members and the chief medical officer. They all looked like they were attending a funeral. General Croft sat comfortably on the opposite side, sipping a glass of iced water. The double doors opened. Nora walked in. She was no longer wearing the oversized, blood-stained scrubs. She wore her Class A Army uniform. The dark green fabric was immaculate. The brass buttons gleamed. The rows of ribbons on her chest told a story of deployments, combat, and lives saved in places most people in this room couldn't point to on a map. The silver eagles of a full colonel sat heavily on her shoulders. She looked 10 feet tall. Dr. Hayes shot up from his chair, nearly knocking over his coffee cup. "Colonel Campbell, please, have a seat. We are so incredibly honored to have you here." "Sit down, Dr. Hayes," Nora said. She didn't take the offered chair. She walked to the edge of the table, placing a thick manila folder on the polished wood. Hayes sank back into his chair, pulling out a handkerchief to dab his forehead. "Colonel, I want to formally apologize on behalf of St. Jude's. The behavior of Dr. Crane was unconscionable. If we had known who you were, if you had known who I was, he would have treated me with respect, Nora interrupted smoothly, which entirely defeats the purpose of my assessment. The room fell dead silent. Nora opened the folder. The Department of Defense was prepared to offer St. Jude's Memorial a $50 million grant to establish a joint civilian-military trauma training pipeline. We need facilities that mirror the chaos of forward operating bases. We need high-volume trauma. You have the volume. Your physical facilities are state-of-the-art. She flipped a page. But a trauma center is not made of MRI machines and sterilized scalpels. It is made of personnel, and your personnel are suffocating. She looked directly at the chief medical officer. Dr. Crane's surgical mortality rate is within acceptable state margins, but his staff turnover rate is the highest in the Midwest region. You lose 30% of your critical care nurses every 6 months. Your residents are sleep-deprived, terrified, and functionally paralyzed by fear of reprimand. We handle a very tough demographic, a board member piped up weakly. It's a high-stress job. Combat is high stress, Nora fired back, her tone sharp enough to cut glass. In combat, we protect our medics. We listen to the lowest-ranking corpsmen if they have a hand on the bleeding. Here, your chief of trauma dismissed a critical observation regarding a dying patient because the person making it was a new nurse. She closed the folder. The slap of the cardboard sounded like a gunshot. I spent 2 weeks mopping floors, stocking shelves, and taking verbal abuse from a man who believes a medical degree is a license for cruelty, Nora said. I watched your charge nurse, Maggie, work 3 consecutive double shifts because Crane fired 2 nurses in a week for minor chart errors. The culture in this hospital is toxic. It is hierarchical to the point of being fatal. Hayes looked physically sick. Colonel, we can fix this. We can implement new training. You will. General Croft spoke up for the first time. His voice was affable but carried a grim undertone. If you want the contract. Nora nodded. I will not authorize military personnel to be trained in an environment that rewards ego over efficacy. If you want this $50 million pipeline, things change today. Name your terms, Colonel, Hayes said immediately. First, Nora said. Dr. Crane is removed as Chief of Trauma immediately. He will face a full disciplinary board for his conduct in the OR today, specifically regarding patient endangerment. If he remains on staff, he does so as an attending surgeon only with mandatory psychiatric evaluation for anger management. Hayes nodded frantically. Done. I'll have HR draft the paperwork before lunch. Second, Maggie is promoted to head of critical care nursing with a corresponding salary adjustment. She is the only reason your ER hasn't collapsed under its own weight. Consider it done. Third, a complete overhaul of your reporting structure. An anonymous, unfireable ombudsman for nurses and residents to report attending physicians without fear of retaliation. I want the draft of that protocol on my desk at the Pentagon by Friday. Nora picked up the folder. She didn't wait for Hayes to agree to the third point. She already knew he would. They were businessmen, and she held the purse strings. You have brilliant people working in your basement, Dr. Hayes, Nora said, turning toward the door. Stop letting arrogant men crush them. She walked out of the boardroom, General Croft falling into step beside her. An hour later, Nora stood by the staff lockers in the basement. She was packing her few personal items from her temporary locker into a small canvas duffel bag. The hospital was quiet down here. The hum of the fluorescent lights was the same as the day she arrived, but the atmosphere had shifted. The air felt lighter. Footsteps approached. Maggie stood at the end of the aisle. The veteran nurse looked exhausted, as always, but there was a strange, unfamiliar expression on her face. A small, genuine smile. I heard Crane is clearing out his corner office, Maggie said, leaning against the lockers. They're moving him to a windowless shoebox on the 3rd floor. He looked like he was going to cry. Nora zipped her duffel bag. He'll survive. Maggie crossed her arms. You played us all, Campbell. I told you to eat dirt, and you were a damn colonel the whole time. I needed to see the truth, Maggie, Nora said softly. You can't see the truth from the boardroom. You only see it from the trenches. Maggie stepped forward and offered her hand. It was rough, calloused, and scrubbed raw, the hand of someone who actually did the work. "Well, for what it's worth," Maggie said. "It was an honor serving in the trenches with you, Colonel." Nora took her hand, gripping it firmly. "The honor was mine. Keep them in line, Maggie." Nora slung the duffel bag over her shoulder and walked out the back exit. She pushed through the heavy metal doors, stepping out into the biting wind of the Chicago afternoon. The cold air rushed into her lungs, clean and sharp. She didn't look back at the towering brick facade of St. Jude's Memorial. She had a flight to catch. There was another hospital, in another city, that thought it was ready for a military contract. She needed to go see if their floors needed mopping. Did you feel the satisfaction when Dr. Crane finally lost his crown? True leadership isn't about the title you wear. It's about the respect you show to the people keeping the system alive. If this story of justice and quiet strength resonated with you, hit that like button and subscribe for more incredible grounded audio dramas. Drop a comment below. Have you ever witnessed a toxic boss get a reality check? Share this video to remind everyone that respect is earned, not demanded.